National Cabinet meets today to try to find a unified path forward through the country's fractured COVID policy, following a week of bitter exchanges between federal and state leaders. The meeting will focus on the capacity of the health system to cope with the COVID surge, amid new questions about the number of deaths expected if restrictions are eased and borders reopen.
The COVID situation in New South Wales and Victoria is deteriorating quickly, and that means the political barriers to reopening are multiplying. We'll have more on federal challenges in a moment, but first let's get the latest from Lara Himes in Sydney and Stephanie Ferrier in Melbourne. Good morning again to both of you. Lara, Australia's vaccine stock was boosted with some new arrivals overnight.
Good morning, Lisa. Well, some welcome news really for the whole of the country. This Pfizer vaccination swap was part of a deal that we undertook with Singapore. 500,000 doses of vaccine landed in Sydney last night. They will be distributed equally among the states and territories on a per capita basis. We'll be replenishing those stocks once our supply levels are lifted. It all came on the back of some welcome news of some restrictions being eased. They're not great, but they're not huge rather, but some welcome relief, particularly for those people in those 12 local government areas of concern. The exercise cap for 1 hour has now been scrapped, although you will not be able to undertake exercise during the hours of the curfew of 9 p.m. and 5 a.m. And also weddings will now be permitted, although there will be some restrictions with that. Only 5 guests, 2 witnesses, a celebrant and a person to record the wedding. No reception, and the wedding must be undertaken outdoors, all on the back of some welcome news too of us reaching that first vaccine milestone. 70% of us have now had our first jab.
All right, thanks, Lara. And Steph, Victoria has seen some changes to restrictions and something on the vaccine rollout.
Yes, good morning, Lisa. The swings are going to be unfurled and the playgrounds are opening today, but only for the under-12s, only for one parent or carer. You will have to check in with a QR code, and also no eating or drinking for the adults. The masks will have to stay on. Yesterday, Victoria recorded 176 new local cases, and all the signs are these numbers aren't going to go down, so it's clear that Victoria is going to have to vaccinate its way out of this. So health authorities have halved the waiting time between doses for the AstraZeneca shot down to 6 weeks. That's the same time as Pfizer. I've got a friend who had a Pfizer booking at the end of this month. She heard this news yesterday, straight away went into her GP and got the AZ shot. So it's hoped that many others like her will follow suit. In the meantime, border restrictions are being tightened. The number of restricted workers that are allowed in is being narrowed, and they'll also have to undergo tighter testing regimes.
Steph and Lara, thank you.
Thank you, Lisa. Let's go to the national situation. As we mentioned, relations between the federal government and some states have deteriorated even further this week over border closures and that reopening plan. The Deputy Prime Minister and Nationals leader Barnaby Joyce joins us now from Parliament House. Mr Joyce, good morning to you.
Good morning, Michael. How are you?
Very well. There's always been a fair bit of back and forth ahead of National Cabinet meetings, but things seem to have stepped up a notch this week. Can Australians watching on be forgiven for thinking that the national reopening plan is starting to come apart at the seams?
Well, let's hope not, Michael, because the Australian people, I know, want the liberties and freedoms they were born with back. We've got to make sure that we progress along that path in a coordinated way as a federated nation. We now see other issues creeping in, especially mental health issues, especially a rise in suicides. And that means that we have to drive towards opening up Australia, opening up in a form that takes into account that COVID will remain with us. It'll be like the flu, a more virulent type of the flu. We must continue our drive towards higher vaccination rates, and we're doing that. Over 20 million people have over 20 million inoculations now. 35% of the population have received 2 inoculations. You're going through your report just before there. You noted that I think it was New South Wales, but 70% of people received 1. And this means that the motivation of the Australian people is absolutely apparent. And we've got to have the Premier's understanding that even on the politics of this, things are changing. People want to get to the other side. They want the premiers to work together. They want to get, like myself and so many others, out of your motel rooms, be allowed to go around the lake, be allowed to do things that you would expect as just a basic right. And I genuinely believe that the weight of opinion now is if they see premiers as being recalcitrant and not working to a national plan of some sort of parochialism, they're going to deal with it and take it out of their political hide at a later stage.
Can you understand, though, the fears, the sometimes deep-seated fears by Queenslanders and people in Western Australia about COVID getting in, especially if, and it looks likely the cases in, say, New South Wales could still be in their hundreds once that 70% double dose target is reached?
I can understand that that's part of the debate and it's part of the argument. But the other side of that, I mean, in everything there's two sides. Would you just stay locked up forever? Do you just isolate yourself from the world? Is that it? Do you become a hermit kingdom all of your own in the South Pacific? It's just not possible. People want their right to travel. They want their right to go between states. I'm sure that the people on the Gold Coast in the tourism industry will be pulling their hair out to say that, well, you've just completely rearranged our economy. How's it going to work? Are you intending on opening a mine on the edge of the Gold Coast? Because what are we going to do for a job if we don't have tourists?
Now, it all comes down to the vaccination effort. Everybody's sort of on a unity ticket on that front, right? And there's a fair way to go before we reach 70%. We just showed pictures of that batch of Pfizer doses coming from Singapore. It followed the deal of 1 million doses coming from Poland. The Prime Minister this week, Barnaby Joyce, said there are more irons in the fire, suggesting more deals with other countries. Given the fact that Australia has had to scramble to sign individual deals with countries like Singapore and Poland, doesn't that underscore what a disaster the vaccine rollout has been?
No, it doesn't, because what it does show is that the adroit process of moving forward, of having basically the global IQ to find where doses are, to bring extra doses in, to make sure that we accelerate the rollout. And everybody knows that rollout is racing ahead now. I mean, the general conversation...
Why didn't we get these doses at the start like so many other countries? Why didn't we get these doses... Excuse the interruption. Why didn't we get the doses at the start like so many other countries?
The general conversation with people is that they've had an inoculation. That's what I'm seeing with everybody around me, and I don't think that's a particularly peculiar subset when I'm back home in the New England. Now, if people want to go back into history and say, well, with foresight, I would have done this and I would have done that, well, you know, we've all got to live our lives again. We do all sorts of things differently, but we don't get that. We live in today and the future, and that's what we have shown absolute competency in being able to accelerate this rollout. We are now making sure we get it through as quickly as possible. The participation is such that overwhelmingly the people watching this will know people who have definitely had one inoculation to be in the majority, and many of their friends will now have two, and that's what they want to focus on. If the Labor Party, when you had on your masthead on the weekend, on the insiders, Mr. Butler, the Shadow Minister for Health, when they said, well, what is the number that you were driving for? There was no answer. So what that shows is political rhetorical flourishes without answers, but merely history lessons, which at the time and prior to that, there was no speeches that they had a different view.
You say people are getting vaccinated. It's great. No one disputes the fact that more people should get vaccinated more quickly. But we hear a lot from people who struggle to get doses. So what do you say, Barnaby Joyce, to the mums and dads of 16-year-olds and 17-year-olds who are desperate to get their kids vaccinated with Pfizer? They simply cannot. And if they can, they have to wait months to get doses, particularly in those hotspots in Sydney. Can you honestly look them in the eye and say the government has done a good job with the vaccine rollout?
We are rolling it out. We started with the most vulnerable people in the community. We started with aged care facilities. We're dealing with people in remote Indigenous areas. We're dealing with people who have disabilities. We're making sure that those who are most likely to be more dramatically affected by the virus are vaccinated first. We also say what is the truth, that your risk, the younger you get, is vastly less. And as children, in many instances, asymptomatic and they wouldn't realise they've got it. We understand, we tell them the truth, that there are exceptions to that. We understand and tell them the truth that when this is over, people will still get COVID, and tragically, some people will die. But we have to be pragmatic and we have to move to a society that is opening up, because the Australian people want their liberties and their freedoms back. And I would also say to those, if we want to do this properly, we must coordinate across the nation and not for, some sort of grand parochial purpose. Say if it's by some magic trick, it'll never arrive in Western Australia or it'll never arrive in Queensland, unless you just want to completely shut the place up like North Korea.
Just finally, I mean, you are talking about telling the truth, and you speak candidly, which I think a lot of people like. Can you honestly say, telling the truth, that you reckon the government has done a good job with the vaccine rollout?
I believe that where we are now, I'm telling the truth. At the start, with hindsight, of course, you do things differently. But we don't live in the past. And what that shows is a disrespect for where we're going here into the future. If you want to have the debate, show the competency of the debate and the competency of your knowledge, and engage in the debate from here into the future. And if that makes things work better, then that is the right thing to do. But if what your weight of the debate is some sort of history lesson, then you're really you're frolicking in the process of thinking, I'll get political gain out of the pain, but I'll never offer any substance in a debate for the future. And that just reflects completely where you were in the past. You had no different ideas. It was exactly the same, just like you have no different ideas now.
You're talking about the Labor Party, of course.
Of course.
Yeah, and we're talking about the real-life consequences of people who are waiting unnecessarily long times for Pfizer. Anyway, thanks for joining us, Barnaby Joyce.
It's always a pleasure, Michael. Thanks, mate.
Yeah, thank you.
500,000 new Pfizer vaccine doses have touched down in Sydney overnight. The doses arrived after a swap deal with Singapore and will be divided between all states and territories. It comes as New South Wales draws close to having 1,000 people in hospital with COVID-19 after another day of record cases, with more than 1,200 yesterday. The state has also become the first to achieve first-dose vaccinations for 70% of eligible adults.
Meanwhile, Canberra is inching closer to meeting that same vaccine milestone as New South Wales. The ACT recorded 12 new COVID cases yesterday, with 2/3 infectious in the community.
Queensland has narrowly avoided another COVID scare after a Gold Coast family who travelled back from Melbourne with symptoms tested negative. The state is on high alert after a second COVID-positive truck driver entered and left Queensland, and that trucker is yet to be interviewed by contact tracers.
Victoria has halved the wait time between first and second AstraZeneca doses to try to fill 60,000 empty appointments over the coming weeks. The interval between shots has been slashed from 12 to 6 weeks.